Yeah, you'd like to think that since people like the VBID idea that it's going to be included in everyone's health plan. And it turns out that that is very far from the case. We have been called the tortoise in the healthcare reform race, in the fact that value-based insurance design has made very slow and steady progress over years. And the biggest hindrance right now is the fact that the fastest growing type of health plan in the United States, called Health Savings Account Qualified High Deductible Health Plans, or HSAs, I'll call them, do not allow VBID principles to be used in anything besides preventive conditions. Because of an Internal Revenue Service regulation, which says you cannot have a service applied any type of insurance until you meet your entire deductible, which in some families could be over $10,000. You cannot use it for any service that takes care of an existing illness, injury, or condition. So that's those diseases that afflict so many Americans: diabetes, heart disease, depression, HIV. You can't cover insulin before you meet the deductible in a high deductible plan. You can't cover AIDS drugs before you meet the deductible in a high deductible health plan. So since that regulation was introduced in 2004, myself and the government affairs folks at the University of Michigan have been trying to persuade the Internal Revenue Service that this does not make sense. We're so glad that you're covering fully the preventive services that fall under our part of the Affordable Care Act, but it leaves out those services that I feel are equally, if not more important. So for 10 years, we've been fighting to change this regulation. And thankfully, we've had legislation introduced that we helped author to propose to the IRS that they must change the regulation to allow health plans to have the flexibility, not mandate, the flexibility to cover an additional amount of services in that safe harbor of not just preventive services, but chronic diseases. And I'll tell you that the support we have seen for this particular legislation has been extraordinary in its breadth across the spectrum of healthcare stakeholders. We are extremely hopeful that this current Congress and perhaps the Trump administration through the Department of Treasury will allow this change. Independent research has shown that this new type of high deductible health plan, which we call the high value health plan because it allows us to cover more things pre-deductible, would be taken up by at least 7 million Americans every year, will lead to better patient experience, certainly higher quality of care because people would access the services that would make them healthier. And maybe most importantly in this political environment, it would actually be a saver to the U.S. economy. And everyone's looking for something that would reduce the deficit to allow us to pay for other issues that cannot be afforded because of the fiscal restraints in Washington today.